back to Dr. Noah's YouTube update, and this week we can look at some interesting things. This one was kind of interesting. Maternal intake of magnesium may protect against eczema in offsprings. I mean, this is kind of common sense. So when a woman starts to have a baby, what the woman eats has an impact on the baby, but for some reason that gets sometimes confused like that. So it's really critical. We've talked about one of the major type of birth defects that still goes on is due to a folic acid deficiency that causes what's called spina bifida. It actually prevents the formation of the spinal column as the baby grows and develops, whether or not it can actually cause death and also kind of deformity. Actually, it's actually deformed and killed more people than polio. So that's a pretty big deal, and it's a simple B vitamin called folic acid or folate. What the science says is that by the time a woman figures out that she's pregnant, it's already too late. The nervous system starts developing very, very early after conception like that. So it's really kind of a more preventive type of thing. You have to really be taking this before you conceive like that. Most vitamins are okay. Everybody's kind of different, so definitely that would be better than nothing, yes. So spina bifida, once again, it can be at like 95% preventable by just using this simple type of vitamin here. So everybody should be on a good multiple vitamin and eating whole grains and nuts and seeds that have high folic acid. And so you don't have to worry about that. You just conceive and you're just already in a healthy state like that. That's why I try to, when I hear couples thinking about it, then you need to get in shape to be healthy, to be free. So what you do before you conceive and of course as you go through your pregnancy becomes an impact. So in this study here, actually from Finland, European Journal of Clinical Nutrition, June of 2011, they were able to show that the mother taking magnesium had a 78% greater, less chance of having eczema with their offspring. So basic nutrients, after calcium, magnesium is the most important macronutrient, macro mineral like that. So having, again, all these nutrients have a big part to play, not only in terms of your own health, but especially when you're pregnant in terms of what happens to your offspring or your little boy or little girl is happening in the future, whether or not it's different types of genetic disorders or different types of health problems that will exist years later. This one has to be a particular skin disease. Following up on magnesium, and maybe just a side step here, magnesium is really a deficiency that we see because of processing food. Calcium always takes the major type of emphasis, but magnesium is involved with over 400 enzymatic processes, so it's a very, very critical thing. Most people are deficient, so making sure that you eat nuts and seeds and whole grains and stuff that have high magnesium and possibly supplementation. I usually recommend a magnesium glycinate because magnesium at higher levels can cause loose stools or diarrhea, so we don't want to do that. But unfortunately, most people are constipated, so actually, by using magnesium sulfate or citrate, can actually act as a little laxative effect. But in this thing, hot flashes. We talked about the landmark study that was done in 2002, where women for 50 years were actually, once again, experimented on in terms of a bad way of causing all kinds of terrible problems for the good of the woman to not have hot flashes, and they used Premarin. Which is actually extracted from a horse, a female horse urine, and had these very strong type of female hormones in it. And they found out that estimates range from 6 to 8 million women died needlessly because of this garbage that was out there. So here's another alternative. This is published in where it's from Richmond. Virginia Commonwealth University, very well known, and also published in support of cancer care, June 2011, that magnesium alleviates hot flashes in breast cancer patients. And so here are women that definitely, are really looked upon. A lot of breast cancers due to estrogen dominance, too much estrogen, that can actually feed estrogen in certain types of Premarin is actually considered a carcinogen. It can actually stimulate, so we want to be real careful about that. Well, here's a wonderful mineral that was taken, and they were able to show at least a 56% reduction in hot flashes just by doing this. Now, there's other wonderful types of herbs, different other types of compounds that, in my patients, 100% comfort in terms of a woman going through this change in life. I mean, women don't have to be cursed because as they get older to have this kind of terrible change in their hormones. And so by some dietary, exercise, stress management, and definitely nutrients and botanicals, they can have a very, very calm and very safe type of transition versus the medical model of giving them very strong type of estrogen compounds that yeah, their hot flashes go away, but then they die of heart attacks, strokes, and cancer and things like that. So that's not good. Vitamin D, it has to do related with lupus. Lupus is an autoimmune disease, terrible type of disease. The medical treatments are very, very, once again, toxic. You're using lots of steroids, lots of different type of effects. Well, in this, from Brazil, published in actually the publication called Lupus, June 2011, they were able to show that people that are, have lupus have a deficiency in vitamin D, and we know vitamin D is a very, very immune modulating, which means lupus is where your immune system goes too much, goes out of whack, it's out of balance, it attacks itself, and we know that vitamin D, especially D3, is able to modulate your immune system like that. So this was actually showed that that there was an important factor in terms of using vitamin D as at least something to correct for deficiency in lupus. So there's some interesting type of facts. I have to clear my voice, and we'll talk to you next time. Thanks.